In his 20 years of providing healthcare in African-American communities, he's witnessed patient after patient reluctant to seek the medical help they need or enroll in clinical trials, worried their care will be impacted by the color of their skin.
Our grandparents, our great-grandparents have passed along the mistrust of the healthcare system.
And as the nation rolls out the coronavirus vaccine, a study conducted by the NAACP and COVID Collaborative found just 14% of African Americans trust a vaccine will be safe, and only 18% trust it will be effective.
And I see the hesitation with African Americans and Latino Americans taking the vaccination just because of historical factors.
Some of my family members say they want to take it. Some say, no, I'm not going to take it.
A decision especially difficult for Ron Lacks, the grandson of Henrietta Lacks.
In 1951, she went to Johns Hopkins Hospital for cervical cancer.
Henrietta Lacks, known as the mother of modern medicine, was portrayed by Oprah Winfrey in The Immortal Life of Henrietta Lacks.
She didn't donate nothing. They took them and didn't ask.
Without her knowledge or consent, doctors collected a sample of Henrietta's cancer cells for experiments. The cells were replicated in a lab and used to develop breakthrough treatments and cures from polio to AIDS, leukemia, and even coronavirus. Her cells have been replicated and sold all over the world, benefiting countless pharmaceutical companies.
The family tried to find out more about it, and doors was really shut in our faces.
And medical experiments on African Americans started long before Henrietta Lacks. There were the men of Tuskegee, Alabama. The year was 1932. The U.S. Public Health Service told 600 African American men, mostly rural farmers, they would be treated for bad blood. But that was a lie.
There were 600 African American men, 399 of whom had syphilis, and they were unknowingly included as subjects in this longitudinal research study.
28 men in the study died from syphilis. 100 more passed away from related complications. The federal government continued the Tuskegee experiment for 40 years. Dr. Peter Millett is executive.
40 years. So this is historical. So Mr. Kennedy has to understand that we don't have time for a person in positions of power that have a distorted view on Blacks being superhuman, on Blacks, you know, there's a study that also shows that doctors believe that Black women can endure more pain than white women. This is all historical. This is all documented as well. So he's not the person to lead a change in a society if he's going to have an old, distorted, old school perspective on Black people being superhuman. I do not give him, not that he has asked me or anyone has asked me, but he does not have my vote. Anyways, I also want to show you this video. Don't forget, I need you all to communicate with me a little bit more in the chat. I need you all to act like you're here. I don't know if you're at work or what's going on, if you're working from home, but can you, interact with me a little bit? This is flynubianmoney.com. I don't know if you all want me to start singing and dancing. I won't do it, but I want you all to interact with me. Say yes, say no. Do you believe Robert F.